In the early days of Western medicine, surgery was a gruesome event. The concept of general anesthesia and pain management was non-existent. The patient would occasionally be given a strong liquor, a dose of opium, or a dose of marijuana, and then the surgeon would proceed. In these days, surgical assistants were large men who had the assignment of pinning the patients to the operating table for the duration of the surgery. Often patients chose death over an operation because of the incredible pain involved and the low survival rate.
In 1772, British chemist Joseph Priestley triggered a series of events that would change the face of surgery forever, with the discovery of nitrous oxide, commonly known as laughing gas, though it would not be used in actual surgery until almost 70 years later.
By isolating certain chemicals in opium, in 1806, German pharmacist Friedrich Serturner created morphine, which he named after Morpheus, the Greek god of dreams.
Beginning in the 1830s, an interesting form of public entertainment arose, often referred to as ether frolics. At these gatherings, a physician would administer doses of ether or nitrous oxide to volunteers from the crowd. Participating in these frolics were two dental students, William Edward Clark and William T. G. Morton.
On December 10, 1844, Horace Wells, a local physician, attended one of these parties. Dr. Wells observed that one of the drug volunteers was completely unaware of a large cut on his leg that had occurred during his experience.
On January 20, 1845, Dr. Wells administered nitrous oxide to a patient of John Collins Warren, a surgeon at Massachusetts General Hospital, in a public demonstration. The purpose of this surgery was to show the onlookers how well the laughing gas could numb the pain, though the exhibit ultimately failed when the patient cried out in pain in the middle of the procedure.
On September 30, 1846, William Morton successfully administers ether to a patient for a dental extraction. 2 weeks later, on October 16th, Morton administers the ether to another patient of surgeon John Warren, who successfully removes 2 tumors from the patient's neck.
Beginning in 1847, James Young Simpson, an obstetrician, uses chloroform as an anesthetic in Scotland, and it quickly gains popularity in Europe. The popularity spreads to the US until the chemical is linked to a high risk of cardiac arrest during the surgery and is quickly abandoned in favor of ether or nitrous oxide.
The world of surgery remains the same until 1880, when a Scottish surgeon invents a technique for inserting a tube in the patient's throat to give drugs during the surgery. This is the beginning of common protocol for the anesthesiologist of today in patient sedation and airway management.